We're going to continue investigating the central nervous system by looking at the nerves that exit from the brain and brainstem before we go down to the spine and the various spinal nerves that innervate parts of the body and allow us to move the muscles of the body and sense inputs from there. There are 12 cranial nerves exiting on the left and right of the brain and brainstem, and we're just going to march through each of those in order. Now, I want you to note, we're not going to go through every single function of each of these nerves. We're going to just draw attention to their major function because this is an introductory video. More details to come later on with more anatomy content. But here, coming off of our brain, associated with the frontal and temporal lobes, is what's known as our olfactory nerve, cranial nerve number 1. And our olfactory nerve, as its name suggests, is going to sense smells. So if we take a look here at this cross section, the olfactory nerve would be lying right here, and it has various nerves going through the ethmoid bone here, an area known as the cribriform plate, and it innervates just the superior part of the lateral nasal cavity and the nasal septum. That's our olfactory epithelium, and that's where smells are actually sensed. Moving on down, cranial nerve number 1, olfactory, has been taken care of. So now we'll see cranial nerve number 2. This is coming off just around the hypothalamic area, and it's associated with the thalamus here as well. But the optic nerve is going to be going to the eye. And we're going to look at eye anatomy in a separate video in just a little bit. So optic nerve number 2 there. Cranial nerve number 3 is known as the oculomotor nerve, and as its name suggests, it is going to be a nerve that's involved in moving the eyes by innervating the extraocular muscles. Now, it also is involved in allowing our pupil to respond to light by allowing it to constrict. So pupillary constriction is also controlled by cranial nerve 3. We're going to skip cranial nerve 5 for a moment and go to cranial nerves 4, the trochlear nerve here on the lateral side, coming from the posterior side of the brainstem, and cranial nerve number 6 here between the pons and the medulla. So cranial nerves 3, oculomotor, 4, trochlear, and 6, abducens, all innervate extraocular muscles. Now, we're not going to go through all of these in detail now, but these are at least showing us a little bit of these extraocular muscles. So here, the eye faces forward, and surrounding it are a variety of muscles that allow it to move up and down, not like I'm moving it, but just kind of to move around in its socket that way, and keep our pupil fixed on whatever we need to look at. The oculomotor nerve innervates all of these but 2, one innervated by the trochlear nerve number 4, and the other by cranial nerve number 6, the abducens nerve. We skipped cranial nerve number 5, but now we will come right back to it. Cranial nerve number 5 innervates sensations to the face. So we have 3 divisions of the cranial nerve number 5. Let's get a quick look at it here first. It's leaving from the pons, just here. So cranial nerve number 5 is known as the trigeminal nerve because it splits into 3 parts, and they all convey sensations from the face. The first part, cranial nerve number 5, 1, or V1, since V is the Roman numeral for 5, is called the ophthalmic nerve. V2, or the second division of the trigeminal nerve, conveys sensations from the cheek area here. It is called the maxillary nerve. And cranial nerve number V3, the third division, called the mandibular nerve, conveys sensation from this area. In addition to conveying sensation, cranial nerve number V3, the mandibular branch of the trigeminal nerve, also innervates the muscles of mastication, like the temporalis, the masseter, and inside the pterygoid muscles. We've covered 1 through 6, so we'll keep marching down. Here, cranial nerve number 7 and 8 come out very close to each other here. Now, 7 often does have 2 parts that fuse later, but they're showing that on this model, so don't be confused by there being 3 branches there. They are 7 and 8. Cranial nerve number 7 is the facial nerve. And the facial nerve is going to do a lot of things involving the glands of the face, so it's going to have innervation for the lacrimal gland as well as the submandibular and sublingual salivary glands. But its most important function that we're going to see most commonly clinically is how it branches, once it comes out the stylomastoid foramen, into 5 different branches that innervate the muscles of facial expression. So cranial nerve number 7, the facial nerve, innervates the muscles of facial expression. And it branches into 5 standard branches going up here: the temporal branch, the zygomatic branch, the buccal branch, the mandibular branch, and a cervical branch coming down this way. Now, cranial nerve number 8 is very close to cranial nerve number 7, and in fact the two of them can often be damaged together if there's a tumor or other space-filling lesion here near the pons and medulla. Cranial nerve number 8 is known as the vestibuloclear nerve, and it is going to be the nerve that's conveying sensation from our inner ear. So our sense of hearing, as well as our sense of balance and equilibrium, is coming from that vestibuloclear nerve. And we'll take a closer look at those structures in a separate section in just a bit. After cranial nerve number 8, the vestibuloclear, we come to cranial nerves 9 and 10. And are going to be located just here on the lateral side of the medulla. And instead of a single nerve clearly making its way out, what we have instead are some rootlets, and the more superior ones will converge to become cranial nerve 9, the glossopharyngeal nerve, and the more inferior ones will converge to become cranial nerve 10, the vagus nerve. Now, cranial nerve 9 is the glossopharyngeal nerve, and like its name implies, it's going to be involved with the tongue and the pharynx. It is sensory to almost all the pharynx, the nasopharynx and oropharynx here. It's going to be sensory and taste sensation conveyed by it from the posterior side of the tongue here, and it innervates a single pharyngeal muscle. Don't sweat it, but it's called the stylopharyngeus. But just be aware it innervates a single muscle, but is sensory for a lot of the pharynx. Cranial nerve 10 is a nice counterpart for it because cranial nerve 10, the vagus nerve, innervates almost all the muscles of the pharynx, as well as the larynx. We'll see in a minute here. But it's innervating all these pharyngeal muscles except for that 1 by 9, as well as the muscles of the soft palate. And cranial nerve 10 conveys taste sensation and sensation from this epiglottic region just posterior to the tongue as well. Now, if that weren't enough, cranial nerve 10 also gives off a branch in the thorax that then comes back up into the larynx, and it innervates these laryngeal muscles. So this recurrent branch of the vagus nerve comes back in to innervate almost all the muscles of the larynx. One exception is this muscle on the outside. It's innervated by a separate superior branch of the vagus nerve, but the vagus does innervate the laryngeal muscles, the pharyngeal muscles, and if that weren't enough, it's going to be sensory to the laryngeal region here, so it's going to be responsible for sensing when water or food gets aspirated into our airway. It's going to be sensory and motor to the esophagus, traveling down from this area, and it supplies parasympathetic innervation to almost all of our thoracic organs and the majority of our abdominal organs. So more on vagus nerve later. Cranial nerve 11 is a bit unusual. It's coming from the upper cervical segments, and it basically is going to travel superiorly through the foramen magnum, and it's going to travel in close coordination with 9 and 10, and it's going to loop out, and they all leave through the same hole in the skull. Now, it's called the jugular foramen, but you just want to be aware that 9, 10, and 11 are all going to be traveling through that jugular foramen, and cranial nerve 11, because it's coming from the cervical spinal cord, innervates muscle, and the muscles it innervates are the sternocleidomastoid and the trapezius muscle in the upper back. So sternocleidomastoid of the neck, trapezius muscle of the upper back. Cranial nerve 11, the spinal accessory nerve. Last but not least, on the anterior side of the brainstem, just a bit more anterior than the vagus and glossopharyngeal, we have the hypoglossal nerve, cranial nerve 12. Now, hypoglossal nerve, all of these roots are going to come together, converge to form a single nerve, and the hypoglossal nerve is motor to the muscles of the tongue. So if we take a look at this same model here, hypoglossal nerve is traveling in, and it's going to innervate the muscles of the tongue itself that allow the tongue to do the variety of functions that it has to move around. And real quick here, if we pull that apart, we can see that in addition to some muscles of the cervical area we've got that are innervated by cervical nerves, I should say, we have a lot of muscle bundles inside the tongue itself going in various directions, and that is what allows the tongue its considerable mobility during speech, swallowing, chewing, and so forth. Alright, that was a quick tour through the cranial nerves. We're going to return and talk about the spinal cord, which extends inferiorly from the brainstem and is going to be traveling in the spinal canal, giving off spinal roots that form the various plexi that innervate the muscles of the body and limbs.